But before we get there, one question is, should people be on testosterone replacement for the rest of their lives? So what's the ramification of getting on replacement?
Yeah, so that's a great question because it all depends on how young you start. So for my younger patients, 20s and 30s, I always start first with a testicular stimulation protocol, HCG or Clomid. Of course, first thing before we even do this, my six-pronged approach is always, let's fix your nutrition first. If you're overweight, if you have insulin resistance, you're eating junk food, let's fix this. Number two, let's get you to move, to exercise. Let's get you to lift weights. Let's get you to get more lean muscle mass. Number three, let's get you to sleep better. What can we do? I've diagnosed so many people with untreated sleep apnea. That was the cause of their low testosterone. If you don't fix the sleep apnea or the sleep, you can't get anywhere. After you've done all of those things, now you decide, okay, let's go to testosterone replacement.
So you have seen, just by doing those three things, by diet, exercise, and sleep, putting on some muscle mass, that some people's testosterone levels were corrected.
Definitely. And especially the younger you are, the more chances of that you are. Okay. Once you pass 40, the chance of it is pretty low, especially in our toxic world. But a lot of my younger men, again, I listen to your podcast, which your guests who talk about natural ways of increasing testosterone. Of course, there are those ways. You try to limit the toxic exposure to endocrine disrupting chemicals. You eat better, you lift heavy weight, you get enough sunlight. All of those things can help. And the younger you are, the more testicular reserve you are, the more chances of that you have. The older you are, the less likely. That's the unfortunate truth. So for young men, once they start, and I have guys that they started with testicular stimulation, and it didn't work for them. So this is when we sit down and we talk, okay, is it time for testosterone replacement? And once you start testosterone replacement, you could stop anytime that you want. Exogenous testosterone does have a negative feedback loop to the pituitary. So when you take outside testosterone, your own body's production stops. That's why one of the side effects of testosterone is testicular atrophy. And it's real. It's real. So if you're not going to need kids anymore, you're on testosterone, you are going to have testicular atrophy, unless I put you on a medication called HCG that maintains testicular size. So there's always ways to do it. But let's say for whatever reason a man decides to come off testosterone, their levels will drop for 2 to 3 weeks because of the negative feedback loop that there was. And usually you'll feel it more by the second to the fourth week. Your level will drop to maybe the 100, low energy, a little blah mood, depression, maybe some sexual issues. Then you'll bounce back to your norm. If you started at 300, you'll bounce back to those 300 or maybe a little lower. Was that enough for you before you started TRT? That's the big question. So a lot of guys, so if they come to me, their baseline was 300, 350. I'm like, yeah, when you stop, you're going to go back to this. Was that enough for you? Were you physiologically optimized when you had this? So for example, me at 48, I started. After 2 years, I'm like, it's kind of annoying doing the injections. I'm going to stop. Within 4 months, I was like, I don't need to be on it, but I'm so much better when I'm on it. Why should I say no? And my goal doing this is to really remove the stigma of seeing testosterone as a performance enhancement medication only, as something that only guys who have erectile problems take. Because if somebody has diabetes and they need insulin, they're not looked at a different way. If a man has low T, and again, the cause of the low T, we're not sure. But could it be exposure that you had? Could it be something that you're exposed to? Could it be something epigenetic that happened? Almost no power of your fault. You don't have power over this. If you need testosterone, you need to be on testosterone. Because the worst thing that can happen to any human being, you cannot self-actualize. You cannot be the best version of yourself. And without the right hormone optimization, you just cannot be.